Hi, I'd like to speak to you about what it's like to go back to the dentist in 2020. I reside in Long Island, New York, and I found out on June 1st that dentists were able to see patients again for non emergency types of treatment. I'm a patient of Dr. Ron Kaminer of Smiles by Design, located in Hewlett, New York, and Oceanside, New York. I wanted to see what this new normal was going to be like going back to the dentist, and I was due for my regular cleaning. So on June 1st, I reached out and via text set up an appointment for Wednesday, June 3rd. What happened is the following experience that I encountered, and this is informative, hopefully, for patients who want to know what it's like to go back to the dentist and for other practices that may want to follow a similar methodology because it really put my mind at ease. So I'm going to lay out that experience for you. During the following days, I received some texts from the office, and the first one is a questionnaire. I'm going to read that for you verbatim so you see exactly what I had to encounter myself. Please take the time and read the following COVID-19 questionnaire. If any of the following questions are answered with a yes, please let us know. Have you had a fever? Have you been diagnosed or in contact with anyone who has had COVID-19 or flu-like symptoms? Have you lost any taste or smell in the last 21 days? Thank you so much as we tried to make this a smooth process for everyone. So I answered no because I had been quarantining. I hadn't had symptoms, fever, lack of taste or smell, no flu-like symptoms. I then got a confirmation of my appointment, but I was also asked to help keep the office staff and yourself safe. We ask that you text us once you have arrived. Please wait in your parked car, all capitals, exclamation mark, exclamation mark. I will text you when we are ready to see you. Please wait for a response, exclamation mark. Then you may enter the office. Thank you in advance for your cooperation. See you June 3rd, 1:45 p.m. All right. So I'm going to bring my mask with me. I'm going to wait in my parked car, and that's when I'm going to text them I'm there, and then I'll wait for that response, and then I'll go into the office. So now I have a understanding of what's going to transpire. That's exactly what I then do. I get the text saying, come right on in. I'm now wearing my mask. I walk up to the front door, and there's actually also a sign on the glass door asking you to wear a mask before you enter the office. I go into the foyer. I go through the next glass door. Now I'm in the waiting room. Here I would traditionally sit down on the couch, grab a magazine. Now the furniture, however, has been all pushed to the side with chairs stacked on top of each other, so there is really no place to sit, which is fine. I don't really want to be in a room with lots of people sitting anyway. They've staggered this approach via the text, so I would assume I'm going to be the only person in there anyway. I go to the front office door counter. The office manager behind the counter is more than 6 feet away, has her own mask on, and asked me to fill out a form with similar questions I did via text a few days earlier. Any fever, any symptoms, etc. I answer those questions. I sign and date it. I actually don't give it to the office manager. I'm now holding on to that paper, and the hygienist comes through the door leading to all the operatories. I hand her that form. She's in full PPE, face shield, mask, gloves. I'm now following her down the narrow corridor. It's a narrow corridor, but again, it's only me and her, so there's no one coming across in the opposite direction. Any door in that corridor is closed, so we just go right directly to the operatory room, and I sit down in the chair. First thing she does is take my temperature, 97 degrees, just from a little forehead scan, and then she asks me to rinse with some hydrogen peroxide. So she pours some in a little sippy cup, adds a little water to that from under the tap, and I can swish and rinse out with hydrogen peroxide. I suspect it's probably a way for keeping myself safe, but more the office hygienist as well. I totally understand. Has a bit of a different taste to it. Don't typically rinse with hydrogen peroxide, but you're fine. Just spit it out and you're all good to go. So now I have my regular cleaning. I've got my mask resting here on my chest so that I can put it back on again later. She provides me the shades because of the bright light overhead, and I have my regular cleaning. When that's all done, I put my mask back on. I'm waiting for the dentist to come into the room so I can have my consult. When he arrives, he of course has mask, gloves. He's got his glasses with the built-in magnification lenses. So as I would normally see him, but he's in, of course, full PPE gown otherwise. Have my regular consultation. No cavities. Thanks for asking. But I feel good that I've taken that step, had my regular cleaning, and I can see how the office is handling this new normal of seeing patients during and I guess post COVID pandemic, the spike that New York had. Things are looking better and things are starting to open up again. So when I'm now done with the consult, I'm free to go back to the counter. They've actually added in some plastic, transparent glass, plastic, so that there's no exchange of airflow between me and the office manager. But there is a little window if I had to put my card or a piece of paper underneath. But they actually did put the card reader on my side. I can take my card, I can swipe it, I don't have to pass anything to the office manager. Once that's all taken care of, I'm free to go back out through the waiting room. Again, nowhere to sit because all the furniture is put to the side. I go back out the foyer, and now I'm out of the building, wearing my mask this whole time. I stood there for a while, wondering where I should really go to next on my day of errands, and I could hear the next patient behind me coming into the foyer, and I realized they're staggering patients so we don't all leave at the same time. It's very smart. So I don't want to block the exit, so I just go on to my vehicle and go on with my day. So let's see the questionnaire text before the appointment, waiting in my car, letting them know I'm there, and then they tell me it's time to come inside, filling out a similar form when I was at the office counter, swishing with the hydrogen peroxide, taking my temperature. Those are really the only real changes. And so it's an easy process, nothing out of the ordinary, really. I was comfortable. I was put at ease. I believe that following all these steps or coming with my mask on helps keep them at ease as well. And I'd like to recommend the services of Dr. Ron Kaminer, Smiles by Design. I'll put his link in the description of the video. I'd also recommend checking out Catapult Education, where Dr. Kaminer and Dr. Lou Graham both provide excellent resources, and Dr. Lou Graham has a fabulous YouTube channel, which I'll put a link in the description of the video as well. So I hope this is informative for patients who want to know what it's like to go back to the dentist, and for other practices that may want to do something similar. Thank you very much.